Joe Riley with National Drug Screening. It's August 2020. We've been through multiple months of COVID-19. And we do drug testing here at National Drug Screening. We do drug testing all over the United States. And there's been some effects from COVID-19 with drug testing. One thing to point out that in the United States, when a huge crisis occurs, we see a big uptick in substance abuse. We see more people drinking, binge drinking, becoming alcoholics. We see more people using illicit substances, today marijuana, cocaine, amphetamines. As an example, we saw the same type of trend after the 9/11 crisis. So with COVID, we're seeing an uptick in substance abuse. In some cases, we've seen some challenges in getting drug testing done. But for the most part, employers, since April, have been able to do their normal drug testing. There are times when maybe a collection facility where you go for the drug test has been closed. Well, if the facility's closed, you have to find another facility. If all the facilities in your town are closed, it's going to be hard to get drug testing done. You could bring in a mobile collector and they could do it on site at your business. But for the most part, we've seen that urine collection facilities across the United States have remained open as essential businesses. So it has not been hard to get a urine drug screen done in the United States in March, April, May, June, July, and now in August. Now, for DOT regulated employers, random testing is required. And so in the first quarter of this year, January through March, there should have been no reason not to get your random testing completed. In the second quarter, there may have been some challenges. Again, the challenge is not, I can't drug test my employees because of COVID-19. That's not an appropriate excuse. A valid excuse would be all of the places in my town that we go for collection are closed. And in order for that excuse to be valid, you would have to document for each particular person that has been selected for a random drug test, you would have to document when you notified them and what happened, what was not available. You couldn't get them tested for some reason. Not that they didn't want to be tested, not that they didn't feel comfortable, but it was impossible to get them tested. DOT will accept that excuse, but we have not found that to be the case. Most drug testing facilities, I would say over 90%, have been open during these times. So with random drug testing, again, typically you have 2.5 months to get the testing done, 3 months to get the testing done. You don't have to get the testing done the day you got the selection list. You can notify your employees when you know that collection facilities will be available, when you know that those employees are available to be tested. So you can work through the challenges of COVID-19 and your random drug testing program. Now, many people are working from home, and many people may have been furloughed or laid off, so they're coming back to work. For DOT programs, if it's past 30 days, you really have to test them, pre-employment, test them again. Now, DOT has granted some leeway on that, so you can return people to work after 30 days without having to do another pre-employment test. Before COVID, that wasn't the case, and that will go back to not being the case. Now, people working from home, they may be coming back to work, or people that were furloughed, you may want to have a company policy that does a drug test when they come back to work. Now, you don't want to just do that without having it be in your company policy. So maybe you do an amendment to your policy that says, based on these challenging times, people have been furloughed, people have been laid off, people are working from home. When they come back to the office, we're going to do a drug test to make sure that they're clean. Remembering that there's an uptick. More people are using drugs and alcohol than they were before COVID-19. As a matter of fact, sales of alcoholic beverages have skyrocketed since April. Sales of marijuana at recreational marijuana retail stores have skyrocketed. So more people are using drugs and alcohol. So you have to be really careful. You have to pay attention to your drug-free workplace policy. Now is not the time to let it lapse. Because if you're not keeping up with your drug-free workplace policy, you may have substance abusers coming to work. They may cause accidents. They may not be productive. They may have high turnover. They may be late for work often. They may steal from their coworkers. All these things can cost your business money. So now is the time to implement a drug-free workplace program if you haven't had one. Enforce your drug-free workplace program if you have one. And if it needs any revisions, get those revisions done. Get your policy updated. Your drug-free workplace policy from 1990 doesn't work today. It needs to be updated. So at National Drug Screening, we can help you with all that. You can visit our website, you can call us, we can help you with drug testing amidst COVID-19, and we can help you with your drug-free workplace policy. Visit our website, www.nationaldrugscreening.com.